So here we're looking at the sartorius on top, and to the lateral edge is our rectus femoris, and then our neurovascular bundle medially. And the femoral nerve is essentially just kind of lateral and superior to the neurovascular bundle, right at the medial corner of rectus femoris. So if you're having trouble finding this view, or you're unsure, am I on rectus femoris or not, what I do is just scan distally until we get all the way down the leg, and then you can see this is it entering the quadriceps fascia, and then we just scan all the way proximal again. And once we're really proximal, we see our sartorius coming into view, and again that view of the femoral nerve in that medial corner of the rectus femoris. We do diagnostic nerve blocks targeting rec fem to assess the effects on stiff knee gait and both hip and knee flexion during swing. Typically we'll focus mostly on this muscle rather than doing a proximal femoral nerve block, because that's going to cause too much weakness by knocking out all the vastus muscles. So to find the area where you're going to inject, the textbooks would suggest it's between the first and second quarter of the thigh. So you scan distally here, and you can see that it looks like there's some branches of nerve and vessels running into the fascia of the rectus femoris. So this is where I would start by trying to inject, but again, checking with a nerve stimulator to see, am I getting full contraction of the rectus femoris? And are these the branches I want? And you would, again, target right in this region. You can scan up and down, looking to see if you can find a better area. But I do think that right in here is where a lot of those branches are coming off the main femoral nerve into the rectus femoris. So we would inject here typically in a lateral to medial in-plane approach. Again, scanning proximally and distally. This is where I think most of the bundles are coming out of the femoral nerve into the rectus femoris. And again, we'll look and put our color Doppler on. You can see that we're right at the neurovascular bundle. So I would come in lateral to medial and just target right beside those vessels in the area of the nerve. So again, this is an in-plane injection, approximately 45-degree angle, and then you come in just lateral to that nerve with your nerve stimulator, making sure you're avoiding the vessels and making sure you have complete contraction of the rectus femoris, and trying to encircle the nerve with freezing agent.